the ability to open the eye. So if you could take a look at this diagram, here's levator palpebrae superioris. We've injected product here, and it migrates down and affects that muscle. So then we have the lid ptosis. Okay. Same slide. So to avoid that, we're going to inject within these parameters. We're going to stay medial to mid-pupillary. We're going to inject 1 centimeter above the orbital rim. Okay. And if we follow that injection pattern, you really shouldn't have a problem with it, okay? But if you do have a problem, there's aproclonidine, 0.5% eye drops. It's an alpha-2 adrenergic agonist, okay? So the end result is going to help the muscle contract quickly, creating a lift. You're only going to have the patient treat the one side that is affected, okay? Because you don't want to increase tone on the normal side, okay? No, these are drops. These are drops, okay? You know, treatment with this can raise the upper eyelid about 1 to 3 millimeters, and that's sometimes all that you really need. So it's 1 to 2 drops 3 times daily until the ptosis resolves. Okay, so eyebrow asymmetry, they come back for your follow-up, for their follow-up visit, and then you see this, okay? We know how to manage this, don't we, based on what we've discussed? So what do you do? Okay. Well, ask the patient, is there one side that you like better than the other? All right, I have an opinion about what's happening here, but she may actually love this. You know, I'm looking at that like this is my office manager that I treated, right? But she may love that. I don't know. So if she loves this, how are we going to remedy this side? With a brow lift, what I taught you, right? We're going to isolate orbicularis oculi, and we're going to inject 2 units there to lift it. Okay, and hopefully preserve that symmetry, okay? Now, what if she loves this side? How are we going to treat this? What can we do? Exactly. Well, the frontalis, I don't know what treatment she had, you know, but if it was frontalis treatment and this side is relaxed and she's got a lot of lateral activity, then you can put a couple units of product here to drop it. You don't necessarily have to go all the way down here, all right? But you could do it around there, okay? And then in the meantime, you're going to take care of some of those rhytids. Okay, go ahead.
Could you indicate on the left eye where you would put to raise that? So
Okay.
I know what muscle you're talking about, but how far lateral would you take?
Okay, so I want some kind of symmetry. So I want to somehow mirror this side. So it looks like a little bit lateral to the lateral limbus. So perhaps up here, okay? I would have her forcibly squeeze and close her eyes, pinch off that muscle, and then inject intramuscularly, okay? 2 units, you can inject 3 units sometimes, 4 units even, okay? But I would start off with just the 2 units, have her follow up. That might do the trick, okay? If not, then try the 4 units, but there's gonna be a ceiling to that, okay? Because it's not just gonna keep raising. Go ahead.
Help me out with this. So by hitting the orbicularis and
Oculi.
ocularis, you're injecting that muscle. So what's pulling it up is the frontalis.
No. Okay, so.
What's raising
Okay.
I don't understand the physics. What's raising the eyebrow then?
Okay, so we are targeting orbicularis oculi. Okay, so it's a constrictor muscle. All right, so typically we have some kind of tone there.
Oh, it's going to,
right?
Negative tone is going to relax.
Exactly, so we're relaxing that to allow it to lift. Okay, so my concern was, you know, as an attendee, like, oh, you're not supposed to inject lateral to mid-pupillary within that 1 centimeter. And here we are doing that, but it's a deep injection into the muscle because we're targeting that muscle and not frontalis. If you're too superficial, you're going to hit frontalis, right? So frontalis is a lifting muscle. We relax that, guess what? It's going to drop even further. Yeah, so be careful with this. If you're too superficial, it's going to even look more asymmetric, right? So over here, same situation, not as bad. So she may actually really like this look, right? So you lift up the eyebrow the way we described over here, okay?
Excuse me, can I ask you what size needle you're using for the IM?
30 gauge or 31,
And
okay.
the length of it?
It's typically ½ inch,
Half inch, okay.
okay? In my practice, I'm using the BD syringes, which is 31 gauge, okay? I just think I have better control. Slightly smaller needle as well. Go ahead, question?
If you wanted to correct that brow and drop it down, and you said just put just a couple units in the frontalis, can you go with an ovivisor in that case?
I mean, I guess you could. So the question is, if you want to drop or lower this brow, can you inject lower? We kind of touched upon that. I think it was your question about doing, or you recommended injecting within the lower third. I mean, you can do that, but look at this. It's pretty prominent, that rhytid, wouldn't you say? She probably had some kind of frontalis treatment. This looks a lot softer than over here, right? So go ahead and kind of kill 2 birds with 1 stone and inject up there. Okay, just as long as you're within that frontalis, it's going to drop it a little bit. Okay, but you might want to capture some rhytids up there while you're at it. Okay. Any other questions? Go ahead.
Okay, you said go muscular, intramuscular, orbicularis when you want to correct the nerve. Typically, how far deep is that if you measure by millimeter?
No. Okay. You're going to pinch that muscle in your between your fingers. Okay. I'm not going to be there for you, right? You got to figure out where your needle tip has to be within the belly of that muscle, right? That's the target. You're targeting that muscle. So it's going to be different for different people. Okay. If my strong muscle guy wanted a eyebrow lift or so, he's going to have a much thicker muscle, and it's going to be deeper than someone with more, softer, finer muscle tone and mass.
Average, you're going about 3 millimeters.
I don't know. I'm not giving you a number. Just deep within the muscle. Okay? All right, so other possible complications. Okay, here's our different areas of forehead, brow ptosis, heaviness. A lot of these are cosmetic. Glabellar region, ptosis of the upper eyelid due to diffusion, the crow's feet, bruising, but that's common with any injection. You could have diplopia, ectropion, the chin, inability to lower the bottom lip, that's cosmetic. The lips, an asymmetric smile, drooling, speech interference. That's why I don't like doing the smoker's lines with the botulinum toxin. Sad mouth, inability to lower the bottom lip. The gummy smile, dropping the top lip just a little bit too much. The bunny lines, an asymmetric smile, drooping of the top lip. The neck, weakness if the neck flexors are targeted, and also dysphagia. Okay. Okay, hyperhidrosis. It's defined as excessive sweating. We all sweat, we all perspire. It's normal, it's natural. But sometimes with hyperhidrosis, it can cause a lot of, anguish. You can't attend certain functions because, under normal conditions like this, you've got a pool of sweat and it shows within your clothing. So, attending weddings and et cetera, formal functions, can be anxiety provoking. So it's estimated that it affects about 2.8% of Americans. So that's around 8,400,000, okay? Most insurance companies cover this, but you have to demonstrate that you've tried something, at least 2 different modalities, antiperspirants and also medication like oral anticholinergics. Actually here for three forms of failed conventional treatment. So that's if you want to do it insurance-based. And then you have to provide a letter of necessity that it affects the livelihood and well-being. So there's a form in the physician portal, okay, for that. Typically, we use 100 units of therapeutic Botulinum Toxin A. So you're going to use 50 for each axilla. You get approval and have the patient pay. So if finances are an issue, they can try 50 units, but they may not have the longevity in terms of, when you compare it with 100 units, where you get about 10 to 12 months of relief. So you could either just inject randomly, concentric circles within the axilla, or you can actually do the iodine starch method, which shows you where the sweat glands are. Okay, so you're going to have the patient shave the underarms. They're going to abstain from over-the-counter deodorants and antiperspirants because you want them to eventually sweat in your office, and that's for a 24-hour period prior to treatment. They're not going to exercise the day of. We're going to avoid hot beverages approximately 30 minutes prior to treatment because you want them to start off kind of dry, and then you want them to eventually sweat. So you're going to dry off the area. You're going to paint the area with an iodine swab, and then cover, even more past the axilla, so you cover everything. You're going to let it dry. You're going to brush the area with cornstarch powder, and you're going to wait 10 minutes. And then this is what you're going to see. Okay, so you're going to target that purple, and then you're going to mark that off so that you're injecting only within there so that you're not wasting product out here. Okay, and then you're going to clean that area off without erasing that border. You don't have to use a surgical pen to mark this, but you want these about 2 centimeters apart from each other. Okay, when you use a marking pen, do not inject within the ink because you're going to tattoo that patient. Okay, use something light like white eyeliner pencil or so. But these are shallow intradermal injections. You're going to leave blebs, so you're going to know where you previously injected. Okay, but just be cognizant of how much product you have. Okay, and just make sure that you cover that entire area. So it's 50 units per axilla. They're recommending injecting at 45 degrees, but again, you can come at whatever angle, but just be aware where your needle tip is. Okay, you just want to be intradermal. You want to create these little blebs. So bevel side has to be up. Minimum depth approximately 2 millimeters. So each 30 gauge half-inch needle is about 12.5 millimeters, right? So half of that length is about 6 millimeters. So you're basically just burying the bevel, okay, to achieve this depth. It's very superficial. Don't inject into the ink. All right, hyperhidrosis of the palms, okay? So you can do the same thing with this. So you're going to use 100 units per palm. Same technique. Typically about 25 to 35 injections per palm. Oh, and then I would put topical numbing cream. Okay, particularly axilla. It's very sensitive. Okay, it's just more comfortable for the patient. For the hands, I would do it anyway, but it's just thicker skin. It's going to be a little bit uncomfortable, right? Because you've got the needle and you're making multiple punctures. Change that needle tip just for comfort's sake. Or if you're using the BD syringes where you can't change the tip, don't load it fully so that you're just injecting a few times and then toss it and then go to the next syringe. There are light-based devices now that we can use for this. Okay, it might be better for the patient in terms of comfort. We good? All right. So we could do this for the soles of the feet as well. Okay. So same kind of thing, but you just want to make sure that you're capturing the webs between the toes. Okay. I've thought about doing this for myself, but I can't get myself to. Because you're pretty much committed, right? A few spots and it might hurt. I don't know. And that's about it. Okay. Any questions up to this point? Go ahead. I really wouldn't use numbing cream just for Botox of the face. Okay, because we're using the smallest needle that they make, right? It's really not that uncomfortable. There are certain different techniques that you can use to make it more comfortable, right? First of all, like I mentioned earlier, we're not using preservative-free normal saline, okay, because that stings, right? You could do other methods, right? You can kind of tap and distract the patient as you're injecting. They also make these devices that vibrate, okay? I follow a lot of different people on Instagram, and they use what's called the Gold Beauty Bar, okay? It vibrates. So you can have the patient just rested on the chin so they really feel the vibrations here and then not really what you're doing, okay? Before I came across the Gold Beauty Bar, I tried to find the most non-phallic looking vibrator, right? And like I'm going through different catalogs, et cetera, and I found something and I was using it. I used it on like a few patients. They were perfectly fine with it. And then this one patient was like, "That's a vibrator, isn't it?" I was like, "No, it's not a vibrator." Right? It's like, "Yes, it is. That's a vibrator." And I was like, "Well, it's never been in a body cavity, but anyway, I used it. It was perfectly fine." And I made some friends on Instagram, and a lot of times they're happy to answer questions. And I asked, "What is that device that you are using?" And they referred me to the Gold Beauty Bar. You can get this at Amazon.com, and I think they sell for like $10 or so. Okay, I got mine in black, but pretty cool stuff. All right, so this is a very basic course, all right? Also with fillers, it's very introductory, and there's a question of, like how do I get more experience, et cetera, how do I learn? And it's going to continue, okay? Back when I was in your position, they didn't have advanced courses, et cetera. So I followed, videos on YouTube. For Instagram, I do that a lot. You're welcome to follow me. All right, Leonardo Medicine. I'll post a lot of my before and afters, some videos so that you can learn. Okay, some other notables to follow. Dr. TJ Tisay. He's one of our guest speakers for the gala. He's been here this year and the last year. Look up Ageless MD. Okay. He posts a lot of how-to videos, which is very helpful. Okay, and then I'll just name off our guest speakers from these galas. There's Dr. Buford. Beauty by Buford is his handle. The spelling of Buford is B-U-F. I'm sorry?
I think it's
I think it's Buford. If I have good internet reception here. It is Beauty by Buford, okay. Let me just pull up my Instagram because I don't want to forget some of these notables. So there's this one really great nurse injector. She goes by Aesthetic Injector. And her name is Shelby Miller. And then another one of our guest speakers, he wasn't here this year, but he was here the initial year, and that's Dr. Jason Emmer, E-M-E-R, has a practice out in Beverly Hills, West Hollywood or so. So I think those are good starting points. Okay, I looked at textbooks, etc., to find out different techniques. You're welcome to take the advanced course. All right, it's just didactic. There's no hands-on for you, but however, there's a demonstration. A lot of times, I was like one of those attendees where I would just see something, I know how to do it. So sometimes that might be beneficial for you. There's also a Master Series Injector class, right? It's a great class. There's usually about 4 or 5 attendees. You have to pay extra. They give you about 4 syringes of product and then some Xeomin as well. And rarely do you have like a 4-syringe patient, right? So you can do this wonderful makeover. A lot of times the patients that you're seeing or the clients, they want that 1 or even maybe a half syringe. But this is a chance for you to actually do higher level injections, okay? That are a little bit more complicated. Right, so there's that. If you are a member, you have access to our physician portal, okay? And it's great. And I never looked into it until maybe a year after I was a member. And I was like, I didn't have to reinvent the wheel. They had all sorts of things that you could download in terms of, pre and post-op instructions, consent forms, brochures. And you are able to edit it to put your name, your logo, your address, etc. Okay, so you have access to that. Another thing in terms of learning, when you start your practice, you're going to contact the different companies out there. There's Allergan that makes Botox Cosmetics. There's Mertz that makes Xeomin. And there's Galderma that makes Dysport.
Do we have their representative today?
I'm sorry?
Do we have their representative today?
I don't recall seeing them out there, okay? But anyway, you're gonna do some homework, you're gonna contact them, you're gonna see what they offer, okay? And each company may have their own training program, okay? Ask around for your different providers. In Canada, I opened up an Allergan account and love their products, etc. And then I ventured into Mertz, and I really enjoyed their product, and I found that I got a lot more teaching with that. Okay, they've been in my office about 3 times. They were supposed to come last month. Like, I don't need you. That's okay, right? But they're coming in March anyway to show me a different technique or so. They've had dinners where it was educational. I've attended 2 of those. They host events at like a dermatologist or a plastic surgeon's office where it's just a really small size, where I'm sharing a patient with maybe 2 other injectors, right? So you have all those opportunities for learning. And then you're going to practice on your friends and family, coworkers, people that are not going to sue you, hopefully, okay? But a lot of the neuromodulators, it's very forgiving. If there's an error, then wait 3 months, it will go away, okay? So that's how I got a lot of my practice, okay? So in terms of pricing, you're going to call up these different companies. You're going to price compare. Okay, you know, some companies, they really don't have much in terms of sales, like Botox Cosmetics or so. It's pretty much the price is set. If you buy like 10, maybe one, you know, an offer, they'll throw in one free or so. Okay, Mertz had this crazy offer that I took them up on: buy 10, get 10 free. Right? I was like, wow, that's amazing. So I did that. And you can buy in bulk and get a much better rate per product. Okay? When I buy in bulk, you're going to ask your rep about the expiration date. Okay? Because the fear is you buy something because it's discounted, and then you're not going through it, and you've got all this product that just expires. Okay? So it's important to ask them about the expiration date. Okay? And then suggested retail price. All right, you're going to call around locally and you're going to figure out what your competitors are charging. Okay, my mistake was I took this Empire Medical training course. These are U.S. prices. I go up to Canada, you know, and I'm advertising $10 a unit. Guess what? I was like extremely high. And the going rate in my area, $10 a unit, was a bit high. So that's what I'll advertise, but I'll say, okay, because you're such a nice person, I'm going to charge $9 a unit or so. Or, you know, they combine it with another treatment and I give them some kind of a discount. Or if they refer a friend over, then they're going to get discounts. Okay? But call around. You don't want to be the most expensive. You may not want to be the least expensive either. But sometimes that could be an advantage, okay, because you're still learning, but it may send off signs that you're not very polished, okay. There are different ways to price, okay. I've talked about pricing per unit. I think that's the most fair way to do it. You can price per area, okay, where, okay, I'm going to charge this much for frontalis, I'm going to charge this much for glabellar complex. There's a male price, there's a female price. Sometimes you come ahead, sometimes you don't, but hopefully that price will always keep you ahead, okay? So that if there's any kind of follow-up tweaking to do, those units are just complementary because they paid for the area, and it doesn't matter how many units it takes to achieve that effect, okay? We mentioned the physician portal. You need a presence in social media, okay? I had, you know, I was very resistant to it. I had an Instagram account. I posted the 5 things that I do. I'm set, you know, but no. You know, clients out there want to see your body of work. It's an opportunity for you to really showcase it, okay? I write a little description, you know, what treatment I did, a little bit of background information about risks and concerns, and then I post them, okay? Anything to add here? You're also going to have a website, okay? There's a whole nother course with Empire geared towards, you know, kickstarting your aesthetic practice with all of this in mind. Okay, we talked about referral programs. So I get a lot of referrals frequently from satisfied customers, and it's terrific, and they enjoy the discounts.
Membership.
I'm sorry?
Membership.
You can do memberships. Do whatever you want to, you know, draw your patients in. Perfectly fine. Okay? So that's about it. Okay, we finished pretty early. Any other questions? Go ahead.
You mentioned 2 things to tell them to sit upright for 4 hours after and then not rub their, you know, their sights. Are there any other, because I didn't see any of that typed out in here, or any other information like that, or any of the things you tell people, don't use ice or anything like
Ice isn't crucial, okay? If there's a lot of swelling for whatever procedure that you've done, whether it's fillers or so, you can ice, okay? It'll vasoconstrict. It will help in terms of comfort, but also I just don't use it standard because it can affect the way that the platelets behave, so that you could have more oozing and more bruising, okay? But again, you're using really fine needles. If you see a little bit of oozing, get on that immediately. You're going to put light pressure on it, okay? If you control that, then the chances are there's really not going to be much of a bruise, okay? With any injection technique, I tell patients, plan ahead. So if there is a wedding or, a meeting, allow at least 2 weeks for you to recover from any potential bruising. Do they ever really bruise from this? Really, no. But on occasion, there might be that blood vessel that you didn't see, and then all of a sudden, they've got a bruise there. But 2 weeks usually does the trick. I recommend arnica, like I did in the meso class yesterday. Yeah, so it's a good product to expedite healing, et cetera. Go ahead. Hold on. Arnica. It's over the counter, Arnica. It's made from the Arnica montana plant. They make topical gels and creams. They also make pellets. Okay, so if a patient has a history of bruising, then you may have them take the pellets, 5 pellets 3 times a day the day before, and they're going to continue until, if they have a bruise, it resolves, or just, yeah, that's pretty much the end point. I'm sorry? Not really. And I never recommended arnica until the arnica people came to my office, gave me some samples, and I've used it with some patients, and I see bruises healing a lot quicker. And I mentioned that I've done dermal fillers to my marionette lines, and I had a bruise here, and I used the arnica cream, or actually the arnica gel, and that bruise was gone after about 4 days. And typically my bruises will last a good week, sometimes 2 weeks, and after about 4 days, it was gone. I was like, so I'm a believer of it.
So it's topical and oral.
Correct. Okay, you had a question over here first?
Can you tell us in a few words, based on your personal experience, on the timing of using Botox and the fillers?
The timing of using Botox, the sequence. Botox is always last, okay? Because with fillers, you're injecting, you're molding, you're manipulating the face, right? So if you have Botox in that area and then all of a sudden you're massaging it, guess what? It's not where you injected it anymore, all right? So typically the botulinum toxin is always going to be last. You could do PRP of the face, you could do fillers, and then Botox last.
Can you do the same visit?
Same visit's perfectly fine, okay? We had a question back there somewhere. Go ahead.
Have you used the AccuVein at all? You use that, or?
You know what? The AccuVein people came to my office, and originally my interest in it was for the PRP procedures. And I'm pretty good with the blood draw. I have a nurse that's just learning. I thought it was a bit too expensive for that purpose. And there's some patients with just really terrible veins, and despite multiple sticks, no good. I had to resort one time to the femoral vein using ultrasound guidance. We got that blood, right? But AccuVein's kind of expensive for that purpose. But now I'm thinking, you know what, it wouldn't hurt to maybe have that, because it would be nice to see where the vasculature is before I inject, okay? I've gotten away fine without it in my practice. They don't really need it. It's,
Do you know if there's something more inexpensive that would work?
I don't know. I remember coming across someone in one of these courses where they got it on the cheap, and I can't remember what the source was. It could have been eBay. I'm not sure if it was Alibaba.com or so. I don't remember offhand. Okay. Any other questions? Go ahead.
Can you do the filler a day after? Which
I wouldn't do filler after botulinum toxin for. If you're doing it, like if they're coming in on the same day.
No, not the same day.
Oh,
Not the next day.
next day is fine, but why have them come back an additional day for something that you could have done?
Model today and the same person getting this for tomorrow.
Okay, so that's perfectly fine because today is botulinum toxin. We're only concerned about that 3-hour window.
About 3 hours.
All right, so perfectly fine tomorrow. All right, go ahead.
I have a little flexed here. Because you use fillers, you're going to raise up the rhytids, right? If the guy has one. But you want to use the Botox last. I mean, it doesn't seem like it makes sense. I think you want to relax the face and then see what you end up with before you start filling stuff out.
I'm not talking about using it on the same area. Okay, a lot of times patients come in for treatment of different areas where filler might be appropriate for one area versus neurotoxin. So a lot of times, okay, say they come in for tear trough infraorbital hollow treatment, maybe with cheek aug, that's all filler, all right? But I want to take care of my rhytids up here. That's botulinum toxin. So, do that afterwards, all right?
I'm talking the same area. Let's say you have
I wouldn't do it the same day, same area. It's one or the other. I would not. It's either one or the other. All right, so if someone comes in for the 11 lines glabellar complex and they're static, they're still there without expressing, I'll say, let's try neurotoxin first. It can soften it. I'm not sure if it's going to eliminate it completely. They follow back up, right? And they're completely satisfied with it. And then you just maintain that, all right? But if they're not satisfied with it, you let it run its course, and then I have them come back after the product has, expired or whatever. It's no longer active, then I will use the filler instead. You follow? Okay. That's how I would do it.
But you would never fill somebody in where you need to and then have them go back to Botox.
I mean, I would just do it the same day. If they're yeah. If you're considering so if it's the same treatment area, it's one or the other, okay? However, if they're different areas on the face and you can have 2 treatments in one day, save the Botox last, okay? Because my concern, I'm in different locations, right? So I may not be there the following day, even though the patient lives in that area. I may be, other side of town. So.
From a medical standpoint, what's your rationale? That's what I'm trying to understand.
The rationale for
Using the Botox last before after a filler. Let's say you do filler in one place, you're saying you need Botox in another place. Why is that the last treatment you're doing?
because typically with filler, you may be molding or massaging the area, okay?
Oh, okay. And you don't
That's
for the Botox.
exactly. That's the only concern. That's why do it last. I mean, you could do it, first if it's a completely different area, but, sometimes you're, rubbing or putting your hand on the forehead while you're injecting another area, so save it for last, okay? That's just the way I would do it, okay? Any other questions?
I just want to clarify. In your practice, you don't ice before or after?
No,
Botox injection. Okay.
no. Get that gold beauty bar or a vibrator. Okay.
Just one more. Can you use the filler as an additive to the Botox?
Filler as additive to the Botox.
Like, you did the filler, and then the line's still there, and you do, the Botox and line's still there. You do the filler like in 7 to 10 days after.
Okay.
To
So when I do filler, the question is you use neurotoxin first, and then a few days later fill in with your filler. I don't like that because when I'm using filler, I want to see the anatomy natural, right? Without any neurotoxin, because then I know how much to fill, right? Because if you are filling based on the effects of your neurotoxin, that neurotoxin is going to wear off, and guess what? They actually maybe needed more product in that area, right? So if there's no neurotoxin in the area, I want it, it's a better indication to me what it's going to look like. All right, so do the filler first, and then see if it's like the glabellar area, and they're still not happy with the filler, then go ahead and use a neurotoxin. It may be that severe of a rhytid that you might have to do that. But typically, it's usually one or the other. Okay? Any other questions? All right, awesome. So we learned a lot today. All right, so for hands-on, we're going to come back to this room. You're going to take everything with you, okay, because we have to rearrange the room. I'll do a demonstration. Who brought models today? Volunteers to be injected? Anyone bring models?
Yes.
Okay, so I'm going to grab Juan because he's probably going to make an announcement about the models, etc. Hold on a second. Vials, while the other two products have 100-unit vials. And I've seen on Instagram one doctor doing a comparison between Dysport and I believe it was Botox Cosmetics. Like, look, this side it's still frozen while the other is moving. And like, he never disclosed, well, how much Dysport did he use, right? So I didn't think it was a very fair comparison, okay? And I'm not sure how he's basing the equivalence in terms of unit, in terms of pricing, okay? So you'll get a feel for the products once once you're using them. I'm not that familiar with Dysport. I don't use it in my practice. I'm perfectly fine with Botox Cosmetics and also Xeomin, okay? So in terms of shipping, okay, Dysport Botox Cosmetics has to be shipped frozen with freezer packs. So you have to put them in the refrigerator or the freezer. Meanwhile, Xeomin, when I receive a shipment, I can put it right into the shelf. I don't have to worry about it, okay? So in Toronto, we get all sorts of ice storms, blackouts, et cetera. And when I was just exclusively Botox Cosmetics, I'm like panicking that that my product survives the ice storms or power outage. I have them stored in 5 different areas. Okay, the chance or likelihood that all 5 will have a blackout very slim, right? But I have my Xeomin as well. It's in my cabinet, and I don't really care what happens in terms of blackouts, power failures, things like that. So there's that advantage, and then there's also the complexing protein, or lack of it, with Xeomin. Okay, so if you developed antibodies to the Botox complexing protein, you don't get that reaction with Xeomin. Okay. All right. So could you grab me another syringe so I can? Because I'm not going to fill up the entire syringe because it's just easier to inject that way. Thank you. Okay. So I'm just splitting up my syringes. I'm just removing the air. Okay, so I'll give this to you. All right, so We'll start with glabellar complex first. So 20 units. So how much did I draw up for the glabellar complex? 0.5, okay, because each spot is 4 units. So just think of tenths, all right? So I need 5 of the tenths, so it's a half a cc. Follow? Okay, so it's a little confusing, all right? So each tenth is 4 units, okay? And there are 5 spots here, each with 4. Okay, so I have a tenth devoted to each spot. And each of those spots is just 4 units. You're going to have to learn how to think in 4s. Okay? So that's 20 units. Okay? You'll get used to it. Okay, so if I wanted to inject 4 units, how much am I injecting? 0.1. If I'm injecting if I'm injecting 2 units, how much am I injecting? 0.05. I think you're getting the hang of it. Okay, it'll make more sense while you actually do it. So I'm going to just alcohol swab the treatment area. And I'm just going to dab so I don't erase my marks. So I'm left-handed. I'm going to come around this way. So pinch technique. I'm going to isolate procerus. You see that? And then it doesn't matter which way my bevel is because it's going to be 90 degrees. Okay, so I'm going to pinch. I'm just going to rest my finger on your nose, and this is just for stability's sake. All right, 1, 2, 3. And I'm injecting 0.1. You okay? Mm-hmm. All right.
How deep are you going?
It's for her, it was pretty much half of the length of the needle. I just want the needle tip to be within the belly of the muscle. Okay. Was that painful?
No.
Okay. I mean, she flinched a bit. Okay, but part of it's getting used to receiving injections. Okay. So we'll work on the corrugator. So same technique. I'm going to pinch and isolate that muscle. Right, I may do the thread technique where it's just one side. Okay, 1, 2, 3. Have a little gauze, please. Thank you. So just gentle pressure if you see any bleeding or oozing. There's really not much going on there. Okay, and you see that little bleb there. Okay, that's typically what you would get. All right, so I did 2 injections. So how much should I have left? 0.3. Okay, so after each injection, you're going to make sure you have enough left. If you have too much, that means you didn't administer as much as you should have. Okay, if you have less, then that means I injected a little bit too much in one of the other areas. Okay, so you're going to be cognizant of that when you do these treatments. All right, so next. 1, 2, 3. So when you do this, you're looking at the injection site and you're also looking at the plunger of the syringe, okay, to make sure that it's moving, that you're actually delivering the product. So we've got a little bleed here. I'm just going to hold gentle pressure. Okay, hemostasis. Okay. And then same thing over here. 1, 2, 3. I'm going to have you hold this gauze. Okay, you can have the patient help you out as well so that you can work on the other side. Trying to do this so that you can see. Since I'm doing this left-handed. Okay, you can still see, correct? All right, so pinch. 1, 2, 3. Okay. Sure. Oh. All right, you can let go. You may not need it. Yeah, you're fine. Okay. Actually, I'll take a fresh one. And I'll have you hold that. All right, so I'm going to take a step back, and I just want to make sure that I'm completely straight on for the forehead. Hold on a second. Look over here. Okay, so I erased one of my marks, but we're okay. I'm just going to hold this here for a little bit. Okay, so forehead is intradermal. Okay, so I want the bevel up. So here is my mark. I'm not going to go through it, okay? I can start off to the side. All right, I'm going to pull tension this way since I'm directing my needle that way. All right, pinch. And then I'm injecting. See how that's raising right underneath that mark. I didn't have to go through that mark. All right, so I started off completely in a different area, but my needle tip was right underneath that mark, so that's what you're going to do, all right, especially if you're using a dark marker, because you don't want to tattoo the patient. All right, you can let go. All right, you can hold that. Okay, so same thing over here, I'm going to pull tension, pinch. I'll take that. And then I'm going to come around this way. You can hold that for me. Pulling tension, bevel up, pinch. I'll take that. Okay, and then 2 units. So I'm injecting how much? 0.05. Okay, getting the hang of it? All right. See how that's a smaller bleb? Same thing over here. So what should I have left? Okay, because we have 6 units for each side, 2, 4, 6, so I should have 12 units left. All right, so that would be what? How much volume should I have left? 0.3, all right, because each tenth is 4. So 4 times 3 is 12, okay? All right, so for crow's feet, you're going to turn my way. Since I'm already on this side, I'm going to treat that side. She's going to turn towards me.
Do you want me to turn my body or just my head?
Actually, turn more. Okay, perfect. And you can still see on the camera. If you could hold that, please. So I'm just going to pull traction, pinch.
Not bad, not bad.
Okay. So the needle is probably getting a little bit dull at this point. You're okay with it, though?
You're very good.
Okay, so let me show you. Let me show you my vibrator that I'm very, very proud of. This is the gold beauty bar, but in black. Okay, so it vibrates. You can hold that and just hold it right by your chin, right there.
Don't put this on Instagram. My kids will see it. You want to switch?
Sure. Okay. So turn a little bit more. Okay, pinch. There's a blood vessel there. We're going to avoid it. Okay. So are you distracted by that?
No, it's annoying.
It's annoying. Okay. That's fine. She's annoyed. She's annoyed by the vibration.
No, I don't. I'd rather just sit.
Okay.
I mean,
So
somebody else might want it.
Yeah, exactly. So patients are very different that way. Some people would rather have the needle. It's not even that unpleasant, all right? But so give them a choice. I'll take that, and then now you're going to turn my way. You can hold that. Okay, I should have 0.15, but I don't just because I lost a little bit of the volume in the hub of the other needle. All right, squint for me. All right, so I'm going to go for this one. That's where the money is in terms of, a prominent rhytid. I'll skip that just because there's a blood vessel there, okay? So I'm going to pull traction, pinch. And then I'll take that. So there you go. Think we're all comfortable with this?
That's it?
That's it. Did you learn anything?
I did. But yeah,
Okay.
Great technique.
Thank you.
Didn't hurt really.
And thank you for our volunteer.
Well, you'll see me tomorrow, so hopefully it'll be great.
Okay, so a little disclosure, all right? I use the concentration that we teach, okay? For teaching purposes, we are double diluting this for you. But you are going to pretend each tenth is 4, okay? When in actuality, it's only 2. And the reason being is that, you know what? After this class, after this weekend, I'm back in Toronto. You're not going to call me up and say, "Doctor, can you fix this?" Okay, so it's diluted so that, if there are any mistakes, it's not as long-lived or pronounced, but there's still product there so that you actually feel it and you're aware of it. Okay? All right, any questions? I'm sorry? So each tenth is 2, but in your mind, it's 4. Regardless, it's spreading about the size of a nickel if you're injecting that tenth. Okay? And typically I do 4s on each spot, particularly in the forehead, but when I was in the dermatology office over the weekend when they were teaching different techniques, et cetera, they were just doing 2 straight up. And I was like, I guess you still get a good result with that. So when you're starting off in your practice, just start with the 2s, okay? And if it works out, perfect. And again, you have them follow up. If they need any more, then you add it then, okay?
So our models will be getting 2.
The models are getting whatever you inject,
Right.
okay? So it could be 2, it could be 1, all right? Or it could be 4, but you're just injecting more if you want 4 for a particular spot, okay? All right, so we're going to break off into groups. Juan has an announcement first.